Sawadee good evening. Welcome to Thai PBS World. Tonight, I'm Atai Teshikitiranan.
And I'm Nabunag, and today it's the first day that the interprovincial travel restrictions for 13 dark red zone provinces are in effect. Thailand's Department of Land Transport announced today that all interprovincial public transport services are being suspended for the 13 provinces under maximum control and restrictions in accordance with the CCSA's 2-week lockdown measures for the dark red zone, while all domestic flights to and from the zones have been suspended. The zone includes Bangkok, Nonthaburi, Nakhon Pathom, Pathum Thani, Samut Prakan, Samut Sakhon, Chonburi, Chha Cheong Sau, Ayutthaya, Yala, Pattani, Songkhla, and Narathiwat. The travel restrictions will remain in force until August the 2nd, but could be extended if the pandemic has not improved. Interprovincial public vans suspended operations at 1 p.m. today, while buses were almost empty. This morning, 13 public vans were in service, enabling people to travel back to their hometowns, such as Chonburi and Rayong. As for public buses in Bangkok, the number of passengers have reduced significantly after the Bangkok Mass Transit Authority announced changes to the bus timetable, where buses will run from 5 a.m. till 9 p.m. at no more than 50% of their passenger capacity to maintain social distancing. Some of the passengers said they had to wait for a very long time for a bus, but they still feel safe as there are not many passengers. Meanwhile, at Don Mueang International Airport, many people booked their flights to fly back home yesterday, as it was the final day before the travel ban came into effect. Many of them told Thai PBS that they decided to fly home due to the increasing number of infections, but that they also felt that the travel ban does not help to reduce them. The CCSA today has also recommended further closures for each province in the dark red zone to consider. These include all sports fields, swimming pools for sport purposes, exhibition centers, libraries, museums, child development centers, beauty salons including hair and nail salons, tattoo parlors, public parks, and botanical gardens. The dark red zone, or maximum controlled and restricted areas, are subject to strict semi-lockdown measures, which include a curfew between 9 p.m. and 4 a.m., staying at home on a voluntary basis, a maximum amount of working at home for state enterprises, closures of several venues, a ban on dining in, and online classes only.
And we can start to see more restrictions being imposed in the near future that goes in parallel with surging infections that we see for the past couple of weeks now. And Thailand today sees another new high of daily infections as 13,002 new COVID-19 infections have been recorded today, just over 1,000 of whom from prisons, raising the total infections since April to over 410,000. At the same time, 108 more people have died from the disease, while 8,248 more people have recovered. More than 130,000 people are being treated in hospitals and field hospitals right now. The country's infection record has been broken each day from Friday, July 16 to Monday, July 19, from 9,692 to 10,082 to 11,397 and to 11,784 respectively. Bangkok tops the chart as usual, both in terms of infections and deaths, with 2,921 cases and 40 deaths reported today. The total infections in the capital in the current wave makes up about 30% of all cases so far. And as for vaccination rate, a total of 14.8 million doses have been administered so far. About 11.3 million first doses have been given, while 3.5 million people, or about 5% of the entire population, are fully vaccinated. Meanwhile, 4 men were found dead mysteriously on the street in Bangkok yesterday. 2 of them posthumously tested positive for COVID-19, according to rescue workers. The first victim, a man about 50 years old, was found lying on the road near Bawon Niwet Temple at about 10 a.m. after he collapsed. Rescue workers tried to administer oxygen to the victim, but he died later. Rescue workers suspect that the man was infected with COVID-19, so they sealed off that section of the road with steel barriers and put up a warning sign. The body was left on the road until 10 p.m. when another team of rescue workers in PPE suits arrived to remove it and spray the scene with disinfectant. Another body, a 60-year-old man, was found in front of the Siksapan Panit store on Rajadamdun Avenue yesterday evening. His body was removed from the scene at about 10:30 p.m. and it is yet to be confirmed whether the victim was infected with the COVID-19. The third, a man aged about 40, was found lying dead on Ramaphore Road in front of a department store. A swab test found him negative of the virus. And the fourth was found near Wat Sutat Temple in Pranakon district at about 7 p.m. and the body was collected at 9 p.m. A test found the body positive for the virus as well.
And at the same time, Bangkok is currently seeing a backlog of about 2,700 people infected with the coronavirus and are waiting at home to be sent to pre-admission centers. The director of Bangkok Emergency Medical Services Center, or Erawan Centre, Dr. Pathum Thani said that the main task of the center is to have the patients, including asymptomatic, mildly symptomatic, and serious cases who are at home isolation, sent to the 25 pre-admission centers scattered across Bangkok. He said that the center is also helping to arrange for the moderate and serious cases to be sent to either general hospitals for the serious cases or to field hospitals for moderate cases. Dr. Pathum said the center's hotline receives hundreds of distress calls seeking hospital beds each day, and 1,800 calls were received yesterday alone. The home isolation system is now accommodating thousands of mild and asymptomatic cases who prefer to stay home to avoid the congestion in field hospitals or pre-admission centers. Meanwhile, at the provincial hospital in the central province of Sarawak, an image showing COVID-19 patients lying on wheeled stretchers outside the hospital because all the hospital's 700 beds are fully occupied was posted on Facebook by a netizen. A medic at the hospital told Thai PBS that some of these patients are under medical investigation and others have mild symptoms, but they are kept outside the emergency ward to prevent the disease from spreading. However, he added that all of them have been moved to the hospital, as officials are in the process of setting up a field hospital to accommodate about 500 patients who are waiting to be admitted for treatment. 163 new infections were logged yesterday in Sarawak and 2 have died. Sirirapia Mahakarun Hospital issued an announcement yesterday advising people to contact the hospital's hotline on 1474 before bringing patients to the hospital, saying that the ICU and COVID wards are now fully occupied and there are many patients waiting to be transferred from the ER.
And Sarawak province is not even the dark red zone with most of the infections, so we have to bear in mind how the situation could be much worse within the dark red zone. For example, in Pathum Thani, which is in the dark red zone, more field hospitals and community isolation programs are being set up to help accommodate the rising number of COVID-19 patients, as many field hospitals in the province are reportedly full, especially with patients from the cluster at Talat Thai, which is Thailand's largest fruit and vegetable market. There are currently 10 field hospitals across 4 districts in Pathum Thani with a combined total of 3,588 beds. One of them has been closed temporarily. Another was open on Monday with a 400-bed capacity, but it is expected that it will be full in a few months. A new facility in Lamluka district was opened yesterday, and yet another in Klong Luang district is expected to open soon as a comprehensive center with semi-ICU facilities and a virus lab. Home and community isolation programs are being set up for green or asymptomatic mild case, with a plan for community programs in every district of the province. Many field hospitals are reportedly taking more yellow cases or those with moderate symptoms. Dr. Apishon Jinsaway, Deputy Chief of the Pathum Thani Health Office, said that the deteriorating situation has led to a shortage of medical staff, as some of the nurses from the health centers were asked to help in other areas. The Ruamjai Rockville Hospital, for example, now has only 5 or 6 medics, which means that more nurses from private hospitals and health volunteers are required. Pathum Thani is among the 13 dark red zone with high number of daily new infections. 476 new COVID-19 infections and 2 more deaths have been recorded in the province today, raising its total since April to 15,818. Currently, there are 300 to 400 patients being admitted daily, while government hospitals can accommodate almost 500 patients, and Thammasat University Hospital can accommodate 76. Most of the hospitals are now full.
So we can see that many of the provinces, including Pathum Thani, there are new infections every day, and the hospitals are being overwhelmed right here with the increasing number of infections. And due to the COVID-19 situation, it has been reported that 3 months of Prime Minister Prayut Chan-o-cha's salary and those of some of the government spokesperson's team will be spent on the COVID-19 survival boxes to be distributed to people in the 13 provinces in the dark red zone. Earlier this month, the Prime Minister, along with several cabinet members, declared that they will forego their salaries for a few months to help in the fight against the current wave of the pandemic, which is the most serious since the spread began early last year. According to the government spokesperson Anucha Burapachaisi, the boxes will contain necessities for people who think they may have contracted coronavirus but can't take care of themselves. Among the items will be thermometers, oximeters, painkillers, Thai herbal medicine, Fa Thalai Joan, surgical masks, and sanitizer gels. Meanwhile, the cabinet yesterday agreed to extend financial support to certain types of businesses and their employees in Chachoengsao, Chonburi, and Ayutthaya provinces, which were recently added to the COVID-19 dark red zone by the CCSA. The business types eligible for state financial support include construction, entertainment, recreational activities, hotels, eateries, retailing, wholesaling, vehicle maintenance, transport operations, warehousing, management and services in support of scientific and technical activities, information and telecommunications. Employees working in any of these businesses will each receive 2,500 baht plus 50% of their normal salaries, but the combined amount of the support must not exceed 10,000 baht and is for 1 month only. The employers will each receive 3,000 baht per employee, but not exceeding 200 employees. Freelancers working in any of the 9 businesses will each receive 5,000 baht. Cabinet approves additional budget to remedy employers and insured employees under Section 33 in maximum and strict controlled areas. Previously, the government spokesperson said that the cabinet has approved the budget framework of 10.9 billion baht for the remedy scheme for employers and insured employees under Section 33 in the businesses located in dark red zone provinces who have been affected by the COVID-19 measures. The approved budget framework will add to the earlier approved 2.5 billion baht to sum up to the total of 13 billion baht for the implementation of the scheme.
And moving on now to vaccination, a group of 604 medical personnel at Ramathipati Chakri Narupadin Hospital of Mahidol University have signed a joint statement demanding the Thai government procure mRNA or protein subunit vaccines for frontline medics, claiming that the existing vaccines are ineffective against the mutated virus, especially the Delta variant. In a statement issued yesterday, the medics said that although most frontline medical personnel are fully inoculated, several of them become infected because the Chinese inactivated vaccine or Sinovac they were given does not effectively protect against the Delta variant, causing a reduction in available human resources and increasing the burden on the remaining medics who are being overstretched to the point that it will impact patients. The group accused the government of mismanagement of the vaccine policy and of miscommunication with the public in the provision of information, procurement, and distribution of vaccines, causing public confusion and suspicion over the transparency of the government and authorities concerned. The group said the procurement of vaccines has been slow and not according to contractual obligations, depriving Thailand of sufficient effective vaccines for the people. They also demanded that the government and authorities concerned be transparent and reveal all the details of the procurement contracts and the distribution of vaccines to build public confidence that everything is being done honestly and without influence by or benefit for a vested interest. Thailand's Public Health Ministry signed a contract with Pfizer and BioNTech yesterday in procuring 20 million doses of the Pfizer-BioNTech, which is an mRNA vaccine, expected to be delivered in the final quarter of this year. The government pharmaceutical organization on behalf of private hospitals are expected to place an order of 5 million doses of Moderna, which is also the other mRNA vaccine, next month for deliveries in late this year and early next year. And so far, Thailand currently administers China's Sinovac and Sinopharm and the UK's Oxford AstraZeneca.
And with the number of infections scattered across the country, many of the medics are working tirelessly to help the COVID-19 patients, and some of them have to travel by boat in order to reach these people in remote communities. Let's find out more in this report.
These two health workers are zipping up their PPE suits, putting on masks and face shields, and slowly climbing into a boat on the banks of a countryside canal. This is the best way for them to ensure remote communities in Samut Prakan, a province on the fringes of the capital Bangkok, get access to health checkups as the country struggles to slow the spread of coronavirus. The workers travel along this small canal every day to provide swab tests for COVID-19 patients who are in self-isolation in the already isolated communities. Charan Ratchayabut, a public health officer who has also been conducting nose and mouth swab tests on other villagers, said that some village areas can't be accessed by land, so they need to travel by boat or raft to check on COVID-19 patients. Local people also help by providing the transport, a narrow wooden boat with a small engine.
ก็สำหรับกรณีที่เป็นผู้ป่วยที่บ้านนะคะเราก็จะมีการซักประวัติแล้วก็สอบถามอาการผู้ป่วยนะคะในแต่ละวันนะคะแล้วก็เราก็จะดูอุณหภูมิร่างกายของผู้ป่วยนะคะเพื่อป้องกันแบบภาวะการติดเชื้อนะคะแล้วก็สอบถามอาการนะคะก็คือดูอัตราการหายใจต่างๆนะคะแล้วก็ดูลักษณะการหายใจนะคะถ้าโดยส่วนตัวก็คือเราก็ต้องทำเพื่อคนไข้อะค่ะแต่ว่าคือการเดินทางก็อาจจะไม่สะดวกแต่คือก็จะมีทางทีมผู้นำชุมชนผู้ใหญ่บ้านแล้วก็อสม.ของพื้นที่อะค่ะที่ให้การดูแลอำนวยความสะดวกค่ะคือเขาก็จะมีเรือของชาวบ้านนะคะที่ช่วยในการนำพาเจ้าหน้าที่เข้ามาตรวจ
The health authority estimates that about 10% of the 60 households in the village are infected with COVID-19. Though Charan Rat and other officials are able to reach the patients for now, they are concerned that the virus keeps spreading even in these remote areas.
ตอนนี้สถานการณ์ก็คือเป็นห่วงประชาชนนะคะเพราะว่าหนึ่งคือด้วยตัวของเจ้าหน้าที่ที่รพสต.เองนะคะก็คือจำนวนของเจ้าหน้าที่เนี่ยมีไม่มากนะคะแต่ว่าจำนวนผู้ป่วยเนี่ยแล้วก็ผู้ที่เป็นกลุ่มเสี่ยงสูงที่รอตรวจเนี่ยเพิ่มสูงขึ้นทุกวันแล้วก็ผู้ป่วยที่จะต้องเข้ารักษาเพื่อรอเตียงอะไรเงี้ยก็เพิ่มจำนวนขึ้นทุกวัน
Thailand reported 13,002 new COVID-19 cases on Wednesday, the sixth consecutive day of record infections, as it deals with its longest-running and most severe outbreak so far.
And from this group, we can see how important medics are and the great length they're going to go for patients, for people across the country that are at risk of this pandemic. And they themselves are of a greater risk even.
Exactly.
And with that, we wraps up tonight's program. And don't forget to follow us on Instagram, Twitter, Facebook, YouTube, TikTok, and our website, www.thaipbsworld.com, for all the latest updates, for example, COVID, politics, Myanmar Report, and many others.
Thanks for watching. Stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ